through their full participation and at a cost that the community and the country can afford. So this definition of primary healthcare is given by the Alma Ata Conference. Okay, so primary healthcare means that here this healthcare is not meant for only me or for you alone. It is made accessible for the whole people, means universally accessible to every individual, and it should be acceptable to everyone. And the every individual should be like fully participate here, and the care provided by this primary health care should be affordable by the community as well as by the country. Okay, and elements of PHC. First is education concerning prevailing health problems and the methods of controlling and preventing them. Excuse me, okay, one second. Okay, so the elements of PHC, the first one is education concerning prevailing health problems and the methods of controlling and preventing them. So for now, corona is one of the prevailing health problems that everyone is facing right now. So the methods of controlling and preventing them means so primary health care are giving education how to control and prevent from this coronavirus. Okay, and then promotion of food supply and proper nutrition. Why food supply and nutrition should be promoted? Because without adequate nutrition and food supply, many of them can have malnutrition and nutrition related diseases like kwashiorkor, marasmus, all those. Okay, and then an adequate supply of safe water and basic sanitation. Primary healthcare should provide adequate supply of safe water and basic sanitation, because if there is improper sanitation or no safe drinking water for drinking purpose, then many waterborne diseases can occur. For example, like the cholera. And maternal and child health, including family planning. So primary healthcare also concerned about the maternal and child health, and that includes the family planning and immunization about major infectious diseases, especially those six killer diseases. Those are diphtheria, pertussis, tetanus, and then poliomyelitis, tuberculosis, measles. So there should be immunization for all these vaccine preventable infectious diseases. And then prevention and control of locally endemic diseases. Here endemic means disease that occur in a specific area. Okay, for example, if malaria occurs in like one district of Assam, that will be called as endemic disease. Okay, so how to prevent and control this endemic disease also primary this primary healthcare is concerned with. Okay, and then appropriate treatment of common diseases and injuries and provision of essential drugs. Essential drugs like iron, folic acid, and those deworming drugs like albendazole and all. And then the principles of primary health care. So here today we are going to discuss only four principles. Okay, but there are also other principles, so later you find it out. The first one is equitable distribution, and the second one is community participation. The third one is intersectoral coordination, and the last one is appropriate technology. So let's see what is this equitable distribution. equal distribution of health services and shared equally by all people irrespective of their ability to pay, and all, rich or poor, rural or urban, must have access to health services. It means that these health services is mean not only for you or me but for everyone, whether the people is residing in rural or urban, the person is rich or poor, but everybody should have the access to this healthcare, and whether they can pay or not, everybody must have access and everybody should get the benefit from this primary healthcare. And community participation, involvement of the individuals, families, and communities in promotion of their own health and welfare. See, the most important thing is the community participation. Okay, there may be like many scheme in the in a like in India also there are many scheme, but the thing is, if the population of India are not utilizing those schemes, then it's of no use. So community participation is very important. Means the community people should have access and should take the benefit from all this health scheme and services. And for this community participation, health guides train and dice are selected by the local community and trained locally in the delivery of primary health care to their community free of charge by overcoming cultural and communication barrier and provision of care acceptable to the community. So to involve the community people, many like trained dice and then health guides, many personnel are being trained to deliver this primary health care. And ASA, that is accredited social health activists, okay, and Anganwadi workers are essential features of PHC. And then intersectoral coordination. So primary healthcare involves, in addition to the health sector or related sectors, an aspect of national and community development, in particular agriculture, animal husbandry, food, education, housing, public works, communication, and other sectors. Here, intersectoral means like uh, the health the health sector will not alone do all the work, but the health sector should coordinate with other sectors like the agricultural sector, animal husbandry, education, housing, and many other sectors. So all these sectors, there should be coordination to provide the primary health care. And appropriate technology. It is defined as a technology that is scientifically sound, adaptable to local needs, and acceptable to those who apply it and those for whom it is used, and that can be maintained by the people themselves in keeping with the principle of self-reliance with the resources and the resources the community and the country can afford. Here, appropriate technology means whenever we give advice to the patient, we should consider the available resources of the community and whether the person can be able to, if technology is there, whether the person will be able to use or not. We should consider all this thing. So, for one example is in a rural area, rather than asking them to buy filter for safe drinking water, we can advise them to boil the water for at least 20-30 minutes and cool it down and to drink. This is another one example, and another can be like these days many of these diabetes patients, they can monitor their blood sugar at home, like by using this glucometer. But there will be always people like who won't be able to use it. So before giving them anything or telling them anything, we should consider the resources available as well as the person whether they will be able to use those technology or not. Okay, levels of healthcare. There are three levels of healthcare. Okay, the first one is primary care level, and in primary care level, this is the level where the individual's family or the community first comes in contact with the healthcare. Okay, and in this healthcare level, all problems are dealt with and resolve it. And whereas in secondary care level, most complex problems are dealt here. And the example for secondary care level are those community hospital and the district hospital. Okay, so more complex problems will be dealt in this community hospital and the district hospital. And tertiary care level. In tertiary again, this is more complex, and in tertiary care level, all the facilities, the patient or the individual will get all kind of facilities here. All the equipment used for testing will be available. And one example of tertiary care level in Guwahati is this Guwahati Medical College and Hospital. Guwahati Medical College and Hospital is a tertiary care level hospital, okay, where the individual can get treatment for all kind of diseases, and many complications are being managed there. Till here, any question? If you have any doubts, then please ask me now only. Okay, if no doubt, then I will proceed with the next topic. The next is primary nursing. Okay, primary nursing. This is primary nursing. This is related to the nursing care delivery system. Okay, nursing care delivery system means how the work of nurses are divided, or how the nurses are deployed in a healthcare setting. So those are the nursing care delivery system. So primary nursing is one of the nursing care delivery system. The concept of primary nursing. Primary nursing was designed to promote the concept of having an identified nurse for every patient during the patient's stay on a particular unit. Primary nursing, in simple term, means there should be one nurse for every patient, one nurse for one patient, like that. Then, why there should be one nurse for one patient is that to deliver consistent comprehensiveness care by identifying one nurse who is responsible, has authority, and is accountable for the patient. So, the nurse who is responsible for that particular patient has the full authority and the accountable for the patient. Means the nurse who is responsible for that patient has the right to make decision for the patient, and she should be answerable for what care she has been provided to the patient. And primary nursing promotes both autonomy and accountability, because here one nurse will be only responsible for one patient, so this helps in promoting both the autonomy and accountability of the nurse. And the definition of primary nursing. So, primary nursing is a method of organizing nursing care in which one nurse is responsible for assessing the patient, planning appropriate care, and evaluating the progress of the patient throughout his or her stay in hospital and on discharge. So, here, primary nursing, it is a method of organizing nursing care. So remember your this nursing process. Okay, so in the nursing process, all those steps: assessment, and then assessment, nursing diagnosis, goal planning, implementation, and evaluation. So in primary nursing also, the nurse responsible for the patient will follow the same that nursing process step. First is assessing the patient. After assessing the patient and gathering information about the patient, the nurse should plan appropriate care, means according to the priority from the information that she gathered. And after planning the care, she will provide the care, and she should also evaluate the progress of the patient, whether the patient is improving or not, and if the condition is deteriorating. All this she has to evaluate, not only during the patient stay in the hospital, but also at the time of the discharge also she should assess, plan, and evaluate the patient. And primary nurse is responsible for, now the responsibility of the primary nurse. Okay, the first one is introducing of self as a primary nurse to the patient and their family. So when a nurse is assigned to a patient, her first responsibility as a nurse is to introduce herself, that I'm your nurse, telling all the names, that my name is this and that, and I'll be responsible for all the care in the hospital, like that. She has to introduce first, and then explaining the role of the primary nurse in terms of what the patient can expect from the nurse. Assessing the patient and family nursing care and needs of education using all the collected data. And then developing short and long-term goals for problems needing nursing care and involve patient and family whenever required. So whenever we provide care, okay, we should always involve the patient and the family. Means whatever the like in the hospital setting and all, whatever the patient can do, like in their activities of daily living, we should always allow them to do. Like if they take time also, we should give some time to perform their activities, and we should also include the family while providing care. And design the plan of nursing care according to the need. This is like formulating nursing diagnosis and providing care according to the priority of the patient. Okay, revise the plan of care and modify if required. Means after planning, you will be implementing your plan. Like after one example is, suppose a patient is having pain. Okay, pain. So for assessing the pain, we usually use this pain scale that range from 0 to 10. So now when I do the pain assessment, if the patient pain score is 5, that is moderate pain. So and then the doctor give a prescription of like give tablet paracetamol, 1 gram stat. So your responsibility here is to give the 1 gram paracetamol immediately to the patient, and you have to make sure that after giving, at least after 1 hour 2 hour, you reassess the pain. After reassessing the pain, after 2 hours 3 hours of also, if the pain is not reducing, and instead if the pain score is like 6 by 10, means the pain is increasing, so in this case you have to modify the plan of care. So in that case you can talk with the physician, and you can give other intravenous analgesic like tramadol and all, and complete the plan of care verbally and in written to other members of the team. So whatever care you have planned, it should be like convey, means inform both verbally and in written to members of the other team. And then evaluate the patient response through outcome and discussion, and make discharge or transfer plan with continued attention, and provide appropriate documentation. Documentation is very important. Okay, like but before doing any procedure, we should not document. documentation should be done only after we complete the procedure. And in nursing, let me tell you, even if you do so many work, if you forgot to do the documentation, it shows that though you are doing the work, but if you are not documenting, means that you are not doing anything for that patient. Okay, so documentation is very important. Right after completing any of the procedure, you should never forget to document the date, time, and then the procedure you have performed, and then the patient response, health condition, all those, and then I have to sign with give signature along with date and time.